Carcinoid syndrome versus serotonin syndrome. Well, this is very high yield for USMLE step 1, step 2, and step 3. And before I start explaining, I will ask just one simple question: that what causes carcinoid syndrome? I will explain stepwise. Before first, I will explain carcinoid tumor and carcinoid syndrome, and then I will go to serotonin syndrome. So, what causes carcinoid syndrome? Yeah, it carcinoid tumor, and where it's located. Yeah, it might be located in the foregut, based on the embryologic gut origin. Basically, carcinoid tumors are divided into three types. They may arise from the foregut, or from midgut, or from hindgut. And classically, the tumors basically they arise from they're specialized neuroendocrine tumors and arise from the neuroendocrine cells, and especially the special kind of neuroendocrine cells called enterochromaffin cells, and also called Kulchatsky cells, which are basically even though distributed throughout the body, but they're present in high concentration in the mucosa of the gastrointestinal tract and in the lungs. So this is actually the origin and its classification. And the most important thing that the tumors that classically arise from the midgut, like from the jejunum or ileum, cecum, appendix, or proximal colon, are notorious for causing the characteristic carcinoid syndrome. So, what is the difference between carcinoid tumor and carcinoid syndrome? Well, before I start explaining the difference, I will ask one question: that carcinoid tumor, what it usually secretes? Yeah, usually carcinoid tumor they secrete the substances like bradykinin or substance P, or serotonin, or prostaglandins. And when the tumor basically arises from the midgut, like arises from the appendix or ileum, let's say, and then it produces these products which via portal vein when enter into the liver, they're metabolized. These metabolites are metabolized in the liver via first pass effect before they produce any systemic signs and symptoms. And therefore, on the other hand, when the tumor, for carcinoid tumor, it has metastasized to the liver, then it produces these substances which enter into the systemic circulation via hepatic veins and inferior vena cava, and then they enter into the right heart, right atrium, and right ventricle. And then they produce characteristic classic systemic symptoms, and which also includes carcinoid heart disease as well. So, what are the signs and symptoms of carcinoid syndrome? So now here's the difference. Basically, when there is a systemic manifestations of these different mediators which the carcinoid tumor produces, that results actually in the carcinoid syndrome. And the main characteristic features include flushing. Actually, that flushing mainly is on the face or on the neck or on the chest regions. And the common triggers for the flushing include stress or alcohol or certain drugs. And apart from flushing, there's diarrhea that is of secretory and watery type. And another thing that we see in patients with carcinoid syndrome is actually bronchospasm, which results in wheezing, and also shortness of breath and asthma-like features. So, how we diagnose the carcinoid syndrome? Well, actually, the first test that we do is 24 hours urinary 5-hydroxyindole acetic acid levels, and then we can also check serum chromogranin A levels, which is itself a general neuroendocrine tumor marker. And then we can obviously do CT and MRI to locate the tumors, and also we can get a octreotide scan or somatostatin receptor scintigraphy, which actually locates the tumor. And most importantly, we need to get an echocardiography where to look for a carcinoid heart disease. And I will explain the carcinoid heart disease at after the treatment portion. And how do we treat the carcinoid syndrome actually? Yeah, the treatment basically involves that we simply blocks the peripheral effects of the serotonin, and for that we usually use octreotide, which is a somatostatin analog, which has a particular affinity for serotonin receptors like SSTR2 and SSTR5 receptor types, and which results the this basically octreotide is a G protein coupled receptor and inhibitory G protein, which inhibits the adenylyl cyclase, and as a result it reduces the cyclic AMP levels, and subsequently reduces the calcium influx, which in turn reduces the exocytosis of the secretory granules, and as a result it reduces the serotonin secretion, as well as it also induces apoptosis of the tumor cells and reduces the tumor burden. And apart from octreotide, we also use a medicine called talotristat. And can you guys explain the mechanism of action of this drug that we use in patients with Carcinoid syndrome? Yeah, talotristat is actually a tryptophan hydroxylase inhibitor, an enzyme which basically catalyzes the rate-limiting step of serotonin biosynthesis. So, and it's particularly effective for controlling diarrhea in patients with carcinoid syndrome. And if the patient is not responding to these drugs, then we can use a drug called cyprohepatidine. And can you guys explain the mechanism of action of cyprohepatidine? Yeah, cyprohepatidine is a serotonin receptor antagonist with a particular affinity for receptors like 5HT2A and 5HT2B receptor types. And as a result, it reduces the peripheral effects of the serotonin. And additionally, cyprohepatidine also has H1 antihistamine properties and anticholinergic properties as well. So we can use this cyprohepatidine as an alternative medicine. Also, we can use this as an adjunctive drug and add to the above mentioned or before the drugs that I already explained. Carcinoid heart disease is like when the serotonin basically, when the carcinoid tumors, they metastasize to the liver, and there these mets produce these various substances like serotonin or other mediators, and they enter into the systemic circulation via hepatic vein and inferior vena cava, and then enter into the right heart. And then the serotonin basically it binds to the serotonin receptors on the endocardial fibroblasts, and as a result it induces different fibrogenic pathways and increases the production of TGF beta, which in turn leads to the deposition of extracellular matrix, and as well as triggers the release of various inflammatory cytokines, and that in fact leads to the formation of fibrotic plaques on the endocardial surfaces of tricuspid and pulmonary valves, and over time it leads to the retraction, thickening, as well as limited reduced mobility of these valves. And here one question that I would ask you guys, that carcinoid syndrome and carcinoid heart disease involves the right heart but does not involve the left heart. What is the reason for that? Actually, the reason is that when this blood from the right heart, it goes via pulmonary artery into the lungs. The pulmonary the endothelial cells contain an enzyme called monoamine oxidase A that basically catabolizes and converts serotonin into an inactive metabolite called 5-hydroxyindole acetic acid, and clears the blood of serotonin before it reaches the left heart via pulmonary veins and via this first pass effect. And then as a result, this serotonin, when it's most of the serotonin is removed from this blood, when it reaches and passes through the left heart, it does not produce any signs on the left heart. But here you should remember that there is an exception to this rule as well, that there's a bronchial carcinoid. You should remember that secretes, produces substances which directly entry into the pulmonary veins, and obviously then the blood that is loaded with serotonin, that when passes through the mitral and pulmonary veins, it also results in the deposition and formation of fibrotic plaques on the endocardial surfaces of mitral and pulmonary valves, and results in either mitral regurgitation or pulmonary stenosis or things like that. And as we see in patients with carcinoid syndrome, where the right-sided involvement like tricuspid regurgitation or slash stenosis, or sometimes pulmonary regurgitation or pulmonary stenosis, we might see in these patients as well. So for carcinoid heart disease, we always do serial echocardiographies to look for the development of these fibrotic plaques. And once it's developed, then obviously apart from the other treatment modalities, you also consider the valve replacement options as well.